Hello, my name is Helen, a cardiology sister.
And I'm Kaylee, Senior Pharmacy Technician. We're here to tell you more about your new oral anticoagulant medication in a short video.
You can pause or rewind the video if you would like to ask questions or would like any part of the video repeated.
Oral anticoagulants, or as they're sometimes known, blood thinners, help to reduce the risk of forming clots. They don't actually thin your blood, they increase the time it takes your blood to clot. There are different types of anticoagulant medication, but yours is known as a DOAC, which stands for Direct Oral Anticoagulant.
You have been prescribed your anticoagulant medication for a condition called atrial fibrillation. Atrial fibrillation is a common heart condition that causes an irregular and often abnormally fast heart rate. Atrial fibrillation can cause problems including dizziness, shortness of breath and tiredness. Some people can experience palpitations or a fluttering feeling in their chest. Some people do not experience any symptoms at all. Atrial fibrillation can affect how your blood moves through your heart, sometimes speeding it up and sometimes slowing it down. This increases the risk of a clot forming inside the chambers of the heart. If a clot forms within the heart, it could break off and travel to the head. This is called a stroke.
You have been prescribed an anticoagulant medication called Apixaban. The dose of Apixaban is 5 milligrams twice a day. The doses should be spaced approximately 12 hours apart. The drug needs to be taken regularly to make sure it is effective. You should not miss a dose or stop taking Apixaban unless a healthcare professional advises you to. If you forget a dose, it should be taken as soon as you remember. You then take your next dose at the usual time. The dose should not be doubled in the same day to make up for a missed dose. There are risks associated with your anticoagulant medication, but be assured that your healthcare professional has carefully assessed the risks and benefits of such a treatment and feels that you would benefit from receiving it.
Since blood takes longer to clot, you are more at risk of bleeding. It is common to notice that bleeding from cuts may take longer to stop and you may bruise more easily. You may also notice some minor bleeding from your gums when brushing your teeth. This is often not a cause for concern. However, we need to make you aware of more serious types of bleeding, which are usually less common. You should seek medical attention urgently if you have excess bleeding or bruising, you find blood in your vomit or when you cough, you find blood when you go to the toilet, for example in your urine or stools, you have a severe nosebleed or a nosebleed which lasts longer than 10 minutes, or you experience severe or unusual headaches.
Your healthcare professional has made sure that this medication does not interact with any other prescribed medication that you may be taking. However, there are certain medications that may interact with your anticoagulant, including drugs such as aspirin or certain painkillers. Anti-inflammatory medicines, including ibuprofen, diclofenac or naproxen, may increase the risk of bleeding episodes with Apixaban. The use of these drugs with Apixaban should be avoided or discussed with a healthcare professional. It is also important to let your doctor or pharmacist know if you are currently taking any herbal remedies, over-the-counter medication or vitamins to ensure they do not interact with your Apixaban. As a general rule, inform your community pharmacist you are taking Apixaban when buying over-the-counter medications or collecting your prescription.
Drinking alcohol can increase the risk of bleeding. Drinking heavily, especially drinking lots of alcohol in one go, is dangerous while taking Apixaban. It is advised that you should not drink more than the recommended number of alcohol units per day. If you are female and of childbearing age, you should avoid becoming pregnant whilst taking DOAC treatment, given the fact that the drug has not been well studied in pregnancy. If you are taking Apixaban and wish to become pregnant, please discuss this with a healthcare professional at the earliest opportunity.
You will be given an anticoagulant information booklet and anticoagulant alert card with your medication. Keep the alert card on your person and show it to other healthcare professionals involved in your care, such as a doctor, nurse, dentist or pharmacist, to remind them that you are taking Apixaban.
Thank you for listening. We hope you feel more informed about your anticoagulant medication. If you have any questions, please speak to the doctor, the pharmacist or the nurse looking after you.